It's so wild that these letters are like 60 years old. My mom died in 2017. A few years before she died, she gave me a packet of letters that my uncle gave to her. Notes written from the doctor who had performed surgery on them when they were younger. We have under our care at Baby's Hospital an infant of 6 weeks with ambiguous external genitalia. So that's one of my cousins. We are very interested in knowing something about their anomalies and the degree of phallic development over the years, these facts being pertinent to the sex rearing of our little patient. It really kind of brings home that these are little people. We're doing these really invasive interventions on little people. I was a little person, and I think we have to make it right. This is me as a kid. This one is me and my mom. I really like this picture because it's just such a tender photo. I'm intact. I'm an intact baby.
Sean Seifawal is a public health researcher and intersex activist who works to end medically unnecessary surgeries on intersex youth. Intersex is an umbrella term for variations that may appear in a person's chromosomes, genitals, or internal organs. There are more than 30 medical terms for different combinations of sex traits that fall outside the typical male and female paths of development. Though the intersex rights movement has been around since the 1990s, its momentum has accelerated in just the past few years, as more and more people in medicine rethink their assumptions about the sex binary.
So this is definitely before surgery. And this one is after surgery. I went from being masculine to being super feminine. And I think that's what caused so much distress in me as a young person, to see my body change in ways that I didn't want. I was castrated when I was 13 years old. I'm 42 now. I think sometimes about what my life would have been like if my body was left alone. And I think all of us really suffer in silence.
There are life-threatening conditions in which genital surgery is required for infants and children. But quote-unquote normalizing their genital appearance to match a sex assigned in early age isn't medically necessary and is still largely up to doctors and parents. After Wall's testes were removed in 1992, he and his mom attended a consultation with the same doctor for another genital surgery.
He described the procedure, and it was seared into my 14-year-old brain. It was seared forever. And he said, I'm gonna shave down your clitoris and I'm gonna create a cavity inside of you. And literally, I remember my stomach turned and I felt so sick. And my mom just happened to look over at me and she was like, do you wanna go through with this? And I was like, no. And that was the one thing that spared me from genital surgery. He didn't bring up anything with regard to loss of sensation or any number of things that happens. It has been documented in the literature that these metrics of success around surgery are based on heterosexual relationships. There are so many assumptions made that I would want a vagina, that I would want to be in a heterosexual relationship, that I would even identify as a woman. I think science is really based on this belief system that there are just only two sexes and that intersex does happen in nature, but it can't happen in humans. And so I think it's treated something as other when in actuality, intersex is so much a part of who we are as human beings.
So what I like to say about sex is that it's always complex. It's not just complex in the context of intersex, but this can sometimes be a hard pill for people to swallow. Our bodies are far more variable than our categories. Part of what's happened is people become slotted into this binary framework.
While gendered social structures are ancient, a binary framework of biological sex didn't actually exist in Western culture until the late 18th century. Before, science recognized only one sex, the male, and considered the female body an inferior version of it. The shift that historians call the two-sex model served mainly to reinforce gender and racial divisions by tying social status to the body.
You think back to the 19th century and the role of men and women and who's allowed in the public sphere, who's allowed to compete in sport, who's allowed to be have careers and otherwise and pursue things. A lot of that gets pinned to biology, right? Men's innate capacities versus women's innate capacities and different things that they're capable of doing. And that carries forward into science, where science becomes preoccupied with looking for difference.
But of course, there were countless people who didn't neatly fit into this binary. In the 1950s, a group of specialists at Johns Hopkins University came together to standardize the medical treatment of infants with so-called ambiguous genitalia. That's when a psychologist named John Money argued that a person's gender identity forms around the time that language develops. To avoid confusion over gender identity, he said, sex should be established in early age, and one's body should match.
Okay. What we learned at medical school about sex variations was that they were sort of a joke of nature, where people who had one kind of chromosomes would have bodies that didn't match that. My daughters were diagnosed with a condition called complete androgen insensitivity when they were 4 and 6 years old. And that was at a time, 1990, when intersex was considered to be pretty shameful and not something that you wanted to talk about a lot. It was generally recommended that you keep it a secret, even from your children themselves.
But this was also the same time that people who were operated on as infants began to feel the effects as adults.
Here we are at the first ever International World Intersex meeting.
I'd never found anyone who, had a body like mine. And the only time I had someone in the medical establishment refer to it, it was in a shaming, patronizing manner.
They removed your clitoris?
Well, they reduced it in size to more closely approximate a normal female appearance.
Does it approximate a normal female sensation?
No.
And I want anyone watching this, be they, historians or doctors or intersex people, whomever, I want you to know that we are just the tip of the iceberg. We are 10 people gathered together in Northern California, but it's just the beginning, and I can just feel how this is going to grow, and we're going to change the way that we're treated.
It really changed my life when I found a support group when my older daughter was 14. I was able to talk to them and tell them the truth. I think we know through science that there is a spectrum of variation for just about everything, including sex traits. And people with intersex bodies show us that, because their bodies exist on a spectrum of difference. I think the issue is that people want to think about gender as a binary. I know people who have different kinds of bodies who are living very happy and healthy lives, and I've also known a lot of people who've had surgery to change things like different looking genitals who are very unhappy about that.
In 2020, Arlene and one of her daughters co-authored the first ever national study on the physical and mental health of intersex adults. More than half of 198 participants had been diagnosed with a depressive disorder or an anxiety disorder. Almost a third reported they'd previously attempted suicide. These findings don't claim to represent the entire intersex population, but they do reflect the need for more community-based research, specifically on mental health outcomes.
You have a lot of research that focuses on cosmetic outcomes of surgery. They'll report that they're able to put something in the vagina that they create. And being able to put something in there of a certain size, they say the surgery was a success, but then no information about when that person goes on to want to be a sexual person, how that's working out for them. The care of transgender children is what's called affirmative care, and you affirm them throughout childhood and into adolescence in working through what their gender is and what they want their bodies to look like. The care of intersex children should be affirmative. It should be taught that their bodies are healthy and perfect. They should be taught that however they feel about their gender is healthy and fine. They should be taught that they have the right to self-determination to decide what they want their bodies to look like, what they feel their gender should be, how they want to express themselves sexually when they grow up. But that's not happening.
People are trying to deny trans people health care, but yet carry out these harmful surgeries on intersex people. Because I was assigned female at birth, I was put on this trajectory without my thorough informed consent.
I think we teach a very erroneous view of biology as being something static and fixed. So we talk about, a trait. And a trait is seen as something you are born with or you develop at age 3, and then you have it. Not as something that develops, that changes, that depends on the environment. A mother will talk to her newborn and she'll say, "Hey, little man." And there's a lot in that phrase. And that gets repeated how many times a day? Little boy, little man, a guy, little fella. It's not very often the parent says little person. That child is already learning that it has a gender. This is happening through the development of their brain and nervous system.
In other words, typically male and female behaviors are often held up as fixed sex differences, rather than differences that develop because of the different ways in which boys and girls are treated in the world.
I think for people asking the question, is your child a boy or a girl? I would really challenge them to just take a moment and ask why. Why is it so important? Are you just happy to have a baby? Are you just happy to start a family? I think those are kind of quality of life questions that often get overlooked and missed in this conversation.
In July 2020, after years of activism by Wall and others, a Chicago Children's Hospital became the first in the country to say it would stop performing medically unnecessary surgeries on intersex infants and children. Hospitals in other cities have since followed suit. In 2021, New York City passed a bill to educate doctors, parents, and guardians of intersex children on the potential harms of these surgeries.
Al, can you see my face? It seems like Intersex Awareness Day is getting a lot busier because I feel like, before, Intersex Awareness Day was like a little peep and it's like, oh, intersex. But I feel like now people are really starting to, I'm just getting more requests to speak and people are like, what can I do? What can I do? So I'm really excited about the opportunities that lay ahead for us.
It was so important to have those years of activism. This is one of the, pressing human rights violations of our time.
I feel like if the principles of medicine are do no harm, if one person stands up and says that what happened to them was unjust and they have experienced harm, I think that should be enough to actually do some course correction. And so that's why this work is so important to me, because what happened to me should not happen to anyone.